So let us start our session again. And previous question unanswered, you can always ask me so that I will be able to answer it now. Make sure that whatever questions you ask are new. Otherwise, old questions, there are a lot of repetitions. So I was just looking at the questions. There were two questions which I sent on Skype. So I'll answer those questions first and then go to it. Now there was a question in relation to stools. See, normally you have lot of consistency, color, and types of stools. Where in homeopathy we have lot of remedies. For example, stools very acrid, stools ball-like, stools bloody, and there are some symptoms, stools clay-like, stools like broth, and stools coffee ground. Some stools are very difficult to get because mathematica wise you can always have a good know about the remedy and all, but sometimes it becomes very difficult for us to, or for the patient to understand how are the motions. So I have a very limited understanding in relation to stools. If it is very very peculiar, then I take for prescription. For example, stools changeable. Whenever the word changeable comes, one remedy that comes in our mind, comes in everybody's mind, is pulsatilla. Yes, pulsatilla is there, but there are other remedies also very important with pulsatilla. Like we have podophyllum, we have dulcamara, we have sulfur. In fact, if the patient tells us the stools are changeable in consistency, the only remedy which is very very important that I have seen in my practice is natramur and not pulsatilla. If the stools are changeable in color, then you can think of pulsatilla, then you can think of podophyllum, then you can think of dulcamara. These are the remedies you can think about. One more variety of stools which is again very common, and that the patients will tell you, stools like balls. And in this, one remedy that everybody remembers is sulfur, but you also think about plumum metallicum, mercury, natramur, nitric acid, and opium. Now there are stools we have in mathematic: ash colored stools and clay colored stools and chopped stools and coffee ground stools. I have not used in my practice because sometimes it becomes difficult for the patient to appreciate what is actually the stools. He will come and tell you that I am passing stools in the commode, so I don't see it. Unless it is very classical. For example, if the patient comes and tells you that the stools are soft, it adheres to the anus. If the patient comes and tells you stools are soft, it adheres to the anus, then you can think about alumina and platina. Hello, Dr. Barbel. Sometimes the stools are very very corrosive. The patient comes and tells you, whenever I pass motions around the anus, I have a lot of burning and a lot of itching and a lot of redness. Then you can think of remedies like arsenic, iris fir, pulsatilla, merxol, and other remedies. So these are the symptoms which you have to take in regards to stools. There were a lot of questions in regarding stools because this is again a non-verbal communication. You cannot control the color, the consistency, and the type of stool. So this becomes very very important. The stools complaint, but we have limited. For example, if the patient comes and tells you the stools are very long, like dog-like stools, then you can think about phosphorus. But I'll tell you one rare remedy which I used in my practice when phosphorus failed, and that is Cimex, Cimex, bedbug. Now I took Instagram live on Thursday, because there were a lot of problem of the language. So we have started Instagram live, especially taking mathematica, the drugs which I will teach as what I've seen in my practice. So today YouTube live is for the public who basically wants English also, because there are a lot of foreign crowds also. So I am taking this also. Sir, having extreme stiffness in my left shoulder, even while doing physiotherapy and while stretching it pains? See, I think these questions, Nitin, you have asked me so many times, Left-sided, if you have left-sided stiffness of shoulder, think about left-sided remedies like Calmia latifolia, like Spigelia, like Guicum, like Macphos. But again, physiotherapy and the underlying cause of disease is very, very important. Okay. Now, one thing in relation to stools, there are some patients in my OPD also. The patient comes and tells you that I have to remove the stools by my finger. I had a case of very old person. He was 97 years of age, and because he could not remove the stools, so he had to appoint somebody to remove the stools from the anus. In that case, you have to remember 3 or 4 remedies: selenium, opium, plumbum, silicea. In that case, I used the remedy selenium, which cured the case. Okay. Now, again, so these are in relation to stools, where I have found in my practice, whatever in my practice I have found in relation to stools, I am telling you. And of course, then there are stools which are very, very hard. Now, whenever the stools hard come, one remedy that everybody prescribes, and that is bryonia. Hard stools as if burnt. Bryonia is the first remedy, it is there. But it is not only bryonia, there are other remedies also which are very, very important. I would say sometimes much higher than bryonia also. Think about sulfur, think about platina, think about opium, think about phosphorus, natrum mure, calcarea carb, alumina, and bryonia also. Stools are hard. Now, this symptom the patient will tell you very, very clearly. And if there are other symptoms in relation to this, the patient will be able to tell you more better. The patient tells you that the stools comes, they are hard, and then they become soft. This is a very, very peculiar symptom which the patient will come and tell you. The stools are hard, then it is soft. In this case, think about magnesium, magnesium carb, magnesium mure, phosphoric acid, lycopodium, and kali carb. Of course, there are a lot of remedies, but these remedies I have used very frequently in my practice. I hope everybody is understanding, because this was the question asked in my WhatsApp, in my Facebook about stools, because this is also a non-verbal communication. Non-verbal communications are very, very important, my dear friends. Now, sometimes the patient will come and tell you that the stools are hard, but they are in pieces. And this word the patient will use in your practice. Stools are hard in pieces. My dear friend, one remedy is very, very important, and that is cortisone. cortisum. Cortisum. Very, very important remedy, cortisum. Otherwise, one more symptom apart from hardness, the patient comes and tells you the stools are large. There was a case, the patient came and told me, Doctor, when I saw my stools, I felt, oh my God, how can I evacuate such a large and big stool? He was also laughing and I was also laughing. We basically, did some symptoms and we prescribed the patient graphitis. Stools are large and passing with great difficulty. That only patient came and told me, sometimes, I have to use a nail and put in between my anus so the stools break and come. It is so large. You can think about graphitis and you can think about sulfur. Very, very important. Of course, there are other remedies also like miserinum, Kalisulf, Leptandra, Calcarea, Alumina. But I have found graphitis and sulfur, when the stools are large and passes with great difficulty. The patient has to break the stools from the anus and then the stool passes. Think about sulfur. I'll take some questions. Sir, my father's age is 80, passing a bit loose motion 2 or 3 times a day, even antibiotics not helping. No problem. At the age of 80, there is no use of medicine. 2-3 times stools is okay. No need to prescribe medicine unless it is indicated. Hi, good day to all. Thank you. Good day to everyone. So let us go forward in relation to stools. Now, sometimes in my practice, I have found that sometimes the patient comes and tells you a very different types of stool. Like the patient comes and tells you the stools are narrow. So if the stools are narrow, you can always take long stools, and the remedies are same only, long stools. Okay, I hope you are getting it. I hope you are understanding that. And the second important thing in regard, apart from the consistency, is the odor. Now, if you ask me, odor of the stools is more important because the patient in this condition are using Western toilets. So they are not able to understand and appreciate how are the stools, they're large or soft or XYZ. The odor of the stools becomes very, very important, and that will give you a very important indication of medicines. For example, the patient can easily differentiate a cadaverous odor stools. Cadaverous odor stools. Of course, everybody thinks about arsenic, but my dear friends, don't give arsenic first. Cadaverous odor stools, the first remedy is carbovec. Second is califos, and you will be surprised. The third remedy which I use in my practice very frequently, cadaverous odor of stools, is lachesis. Good afternoon, Bharat. Which works best, podophyllum malus, for the loose motion in old age? Every remedy which is indicated is best. In old age, there are other remedies also that you should think about. Apart from podophyllum and aloes, think about ammonium carb, think about sulfur, think about natrum sulf. These are also very, very important. Good afternoon, Jehi. So first is cadaverous odor stools, which basically the patient will be able to tell you. Second, the odor of stool is egg-like stools, rotten egg. The patient will definitely tell you this symptom. And the remedy you must think about is chamomilla, calcarea carb, carbo animalis, and do think about sorinum. Very, very important remedy. Sorinum. If you are not able to understand, if the patient is not able to understand, just take offensive stools and all the remedy will be covered. In our Mater Medica, we have fishy odor of stools, fleshy odor of stools, fish burn like stools, garlic odor like stools, gunpowder like, but I have not been able to differentiate these stools in my practice odor. So I will not be able to answer clinically, though theoretically I know which are the remedies. But if I have not prescribed, I will not tell you the remedies also. Okay. So let us go with the one question. Sir, medicines for left-sided renal stones with pain in kidney region, radiating in back, and no problem in urination. So, my dear friend, in this case, there are 2 or 3 remedies that you should think about. First of all, left-sided stools, left-sided complaints. Whenever if you're dealing with renal stones, make sure that you understand how is the pain. That is very, very important. Okay, very, very important. Anyone? Left-sided renal stone. There are so many remedies. If you open the books of Mater Medica, left-sided, think first about colocynth, second about zincum metallicum. In fact, left-sided region is also lycopodium. Of course, lycopodium is right-side remedy. Still, lycopodium is there. Agaricus and calcarea carb. The calicarb also. These are the frequently used medicines which I have seen in my practice. In the Mater Medica, there are a lot of other remedies also, my dear friends. Okay. Yes. You must know some symptoms of calicarb. Calicarb has very. I'm explaining what to ask to your patients. Okay. Dull stitching pain in the renal region. First during expiration, afterwards in close succession, coming and going. This is a very classical symptom of calicarb. This is how we have to ask the patient. For example, a calcarea carb patient will always say that there is a very pressive pain in the renal region. Are you getting me, my friend? Calicarb, Calcarea cup, how will the patient say about the bubbling sensation? Berberis vulgaris. So a sensation, a drawing pain, a radiating pain from the renal angle to this. So this is very important, the character and the type of pain that you have to ask in your patient also. And of course, left-sided you cannot miss out lachesis. So in this short part of stool complaints, I hope you understood something about stool complaints. There are, yes, so whatever remedy I have told you, just okay. So let us go forward. Let us go forward. Sometimes there are remedies, like I told you something about pieces of stools. Now the patient also can tell you something about sheep dung stools. The patient comes and tells you that my stools are like sheep's. When the sheep passes through like sheep's dung, and the first remedy that we have taught in our Mater Medica in our college is Chilidonium. But my dear friends, do think about opium, nitric acid, sulfur, nitramure, plumbum. If I want to summarize everything, there are few remedies in your stools complaint, in non-verbal complaints. These remedies will come in your Mater Medica chart. That is sulfur, opium, nitric acid, nitramure, plumbum, alumina, calcarea, chilidonium. These remedies are very common in most of the stool complaints. So if you don't understand, then you can always club and then go to the remedy. Okay, so let us stop this topic here. I hope everybody got some idea in relation to stools. Jaw pain from air nowadays. Okay, all the mandibular region. Okay, pain. What are the remedies? See, whenever you have a pain in the jaw, and now if you tell that because of this type of complaints, like weather. Now, if you have asked me the question, you have actually asked me the given the symptom also. So cold air. So all remedies which are chilly, which are very very important. Hiparsulf, sister scan, arsenic, calcarea carb, calcarea as. These are the remedies which become very very important in this type of complaints. Okay, is it okay? So let us go forward. No desire to go any activity in depression. Patient only want to either Oromate 30. I think these are the questions you have asked so many times in the YouTube, and every time I tell you, understand and first verify the cause of depression. The symptoms of depression would be same in most of the complaint: desire to lie down, no desire for work, blah blah blah. Understand why. This is very very important, and then you can ask me the remedies rather than just one word depression. It will not work, my dear friend. Okay, so let us go forward. Now, in relation to jaw pain, whatever remedy of course you can add Restox also, and then you can add remedies like arnica, belladonna, magnesium carb, phosphorus in this jaw type of complaints, especially in cold weather or in winters. So let us go forward. Anyone? I hope you're understanding, everyone, because I think most of you were also there in my Insta live. I have taken Insta live on Thursday. So now we have two lives, one on Thursday and one on Saturday. You can always ask me, and ask me questions where I can be able to tell you drugs which are very very close to your questions. If you ask me generalized, then it will be very difficult for me to answer, because generalized symptom, then I will tell you a lot of remedies where you will be only searching for remedies like you're searching in the repertory. So your questions have to be precise. Like for example, I told you something in relation to stool complaints. I hope you understand that. Now stools, last what I told you was like sheep's dung. Now there are a lot of other type of stools and like sponge like and spotted and square, stingy, tallow like, tarry looking, tenacious. These are a lot of stool complaints which I have not seen in my practice. If at all I've seen also, I have not been able to clinically decide whether to take which rubric. So I will not be able to answer this question. Instagram live I took on Thursday at 3 o'clock, same only. Okay, so I hope this part of stools is complete for non-verbal communication. Somebody had asked me a lot of questions in relation to stools, so I've just tried to complete. Again, non-verbal communication includes urine also. So urine is also important complaints. For example, I had a very interesting case. The patient came and told me that the color of the urine is black. Very, very difficult to understand unless you have the pathology behind it. But when I saw in the repertory, I asked the patient few symptoms. So I'll take the question first. 3 months baby fever after vaccination. Again, a very, very, a very, very interesting question. And, you have to be lucky sometimes, to get this type of in your practice. My dear friend, if the baby has fever after vaccination, and if you want to prescribe only on this symptom and you have no other symptoms, don't start with thuja. Please give the patient carcinosin. Carcinosin, I have seen, gives fantastic results if there is fever after vaccination. Of course, you can think about thuja, you can think about vaccinum, you can think about molybdenum. But in my practice, I have seen in many cases, carcinosin has worked beautifully and giving me results. If it's a 3 months baby, if possible, give carcinosin in LM potency and it would work beautifully. Okay. So let us go in relation to urine. Now urine black in color, and then in that case I tried to get other symptoms, and we prescribed the patient tucrium, terebinthina, urine black, and what a fantastic result the patient had. So black urine, think about terebinth, think about lachesis, think about colchicum, and one remedy which you must think about is Pareria brava. Of course, in Pareria brava, because of the stool problem, it slices the mucous membrane, and because of this, the urine is black in color. Yeah, thank you, Zinat, and thank you for the motivation. Everybody requires motivation, including me. So whenever you give me thumbs up or some other 100%, I'm happy that I'm able to deliver what I wanted to. Whatever questions you have asked. My father had 80 years suffering from cough in chest and throat at night 11 to 2, sir, which disturbs his sleep. Tongue is clear. Yes. So, of course, if it is your father and the patient is 80 years, the sleep is disturbed. It is very, very important for them to have a good sleep. So you can think, you see, 11 to 2 in this case, I would not like exact the modality of arsenic, but think about remedies like ammonium carb, in fact ammonium more also, sulfur, calcarea carb, kali sulf. Urine while coughing, there are a lot of remedies. Think about causticum, think about phosphorus, think about rustox, think about calcarea, a lot of remedies. Depression, medicines, religion, mania with. See, whenever you are suffering from mania, and see, mania is a very, very broad sense. Mania for what? There's one rubric called as, I'm not answering first, there's one rubric called as fanatism. In fanatism also you can take that as mania, and the remedy is thuja. But in religious affection, this religious mania, thuja is not there. So what rubric you take for prescription is also very, very important, my dear friend. For religious mania, think about Veractrum, think about lachesis, think about platina, think about pulsatilla, think about stramonium. But if it is out of control, it is fanatism, think about thuja. Vocal tics due to stress, we have already answered this question in previous YouTube, so please ask some other question from the what. Okay, from Zenith Kausar. Okay, we have done that. Thank you, Naz Homeopathy. Yeah, thank you. So I hope religious affection is taken care of. Now we were talking something about non-verbal communication. Color of the urine is black. I hope you understood that the remedy terebinthina. Make sure that you use this remedy. It has a very good results. So terebinthina, lachesis, colchicum, phosphorus, Pareria brava. Now sometimes sometimes the urine the patient comes and tells you is green in color. I have had a very interesting case when the patient came and tell me that the urine is green in color. So of course in your practice you will get only few cases where you have this type of urine green in color. I have prescribed the patient, I think, a dose of camphor, and that treated the case very well. Okay, so thank you, Dr. Tanu. All the best. Thank you so much. So sometimes the urine red in color. Now this urine will get in lots in your practice. It may be related to stone, calculus. It may be related to some pathology related to kidney, nephron, urethra, bladder. So if you have urine red in color, that becomes very important. Remedies like cantharis, trimonium, benzoic acid, bryonia, sepia are very important. I had a case where the patient came and told me, Doctor Sahab, the urine is so red. I got fearful. मैं घबरा गया. I got really frightened after seeing the urine. My dear friends, we have a rubric, the urine is blood red. So whenever the urine is blood red, think about Crotalus horridus and think about Berberis vulgaris. There are other remedies also, but these two remedies I have found very useful in my practice. Crotalus horridus and Berberis vulgaris. Urine is blood red or bright red in color. Okay, are you with me, everyone? Are you with me? This is again a very important non-verbal communication. I just remember one case which just came last week where the urine was frothy. The patient comes and tells you jhag wali urine, foamy urine, frothy urine, frothy. Do think about spongia. Spongia, we always think about cough, dry cough. The cough is dry as if a saw is driven through a pine board. That is there in spongia, but every time difficult to appreciate this symptom. Spongia also has one mental symptom which I always tell in a practice: mournful event the patient cannot forget. And one important symptom of spongia urine is frothy urine. My dear friends, frothy urine. For frothy urine, think about spongia. And one more remedy which we use very frequently for coryza, and that is allium cepa. Frothy urine, do think about spongia, do think about allium cepa, do think about chelidonium, and of course Berberis vulgaris. Berberis vulgaris, if you see, there are a lot of symptoms, and urine complaints are there. I had a very classical case where the patient got the urine in a bottle and told me, sir, my urine is like milk, milky urine, also called in medical term disease wise chiluria. Think about epismel, think about phosphoric acid, think about hipersulfan, think about lycopodium. Recurrent headache after any stress, think about argentum nitricum, lachesis, gluonine, sulfur, calcarea, carb, and phosphorus. Urine always yellow with liver affection. Now see, sometimes what happens when the urine is yellow. Uh, it becomes, depends on how is the yellow color. It is deep yellow, bright yellow, light yellow, lemon colored yellow. These are symptoms which come in jaundice. Bright yellow, sarsaparilla. Dark yellow, chelidonium, caliphos, calcarea carp. Golden yellow, sepia, rheum. Lemon colored, chelidonium. So this depends on the which jaundice are there. That is important. Cancer, I'm just taking a beautiful webinar, in fact a cancer series in Dr. Batra's Academy. I'll just finish that now in the Batras and get back to you in the next YouTube, because it's a very detailed thing in urine complaints. So it is already half an hour up, and thank you so much for joining me, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Thursday for my Instagram live. Thank you.